Hey there. I want you to stop everything you're doing right now and listen carefully. Because today, we're talking about one of the most important, most urgent, and most overlooked signals our bodies can give us, especially if you're in your 70s or beyond. You might think you're perfectly fine, or you might just chalk up certain changes in your body to old age. But there's a specific sign that doctors, nurses, and researchers from institutions like the National Institute on Aging and Johns Hopkins Medicine have been studying for years. They've discovered that when this sign appears, it can mean that the clock is literally ticking. We're talking about maybe even hours left on this earth. And if you see this sign, you must not ignore it. It's something that could spare you or a loved one untold heartache and allow time for crucial decisions. So buckle up. This is going to be an eye-opening video that you'll want to share with everyone you care about, especially those over 70. Let me paint you a picture. Imagine you're sitting next to a loved one, maybe your grandmother or grandfather, maybe your spouse or your dear friend, and you notice something off. It might seem small at first, so small that a lot of people dismiss it. But experts say this sign is one of the biggest red flags that can pop up before a catastrophic decline. This is not about scaremongering. This is about facing reality head-on. According to multiple peer-reviewed articles in medical journals like the Journal of the American Geriatric Society, there are distinct changes that our bodies go through in the final stages of life. One of the most prominent, and arguably one of the most chilling, is called Cheney-Stokes respiration. It might sound like complicated medical jargon, but I promise you, in just a few minutes, you'll understand exactly what it is, how to recognize it, and why it's such a dire warning. Before we dive into this sign that heralds the possibility of death in a matter of days, let's discuss why it's so critical to pay attention. You might think, well, I'm in my 70s. I've made it this far. What could be so urgent? Or, that's just part of getting older, right? Not necessarily. Yes, our bodies do slow down as we age. Yes, we might get tired easier, or have a few extra aches and pains that we didn't have when we were 20 or 30. But there's a world of difference between general age-related changes and those warning signs that indicate the body is shutting down. If you wait until it's too late, you might not get to do or say all the things that truly matter. Or you might ignore a sudden change that could have been addressed, maybe even treated, if you'd acted quickly. Medical experts like Dr. Joanne Lynn, a geriatrician who's done extensive research on end-of-life care, have emphasized that being aware of these signs can make an enormous difference. And it's not just about the difference between life and death, although that's certainly part of it. It's also about quality of life in those final days. Nobody wants to spend their last moments in unnecessary pain or confusion. Nobody wants their family and friends to feel blindsided, robbed of precious time together. Recognizing key signals from the body can provide clarity. It lets loved ones gather for final goodbyes, or it can alert you to a medical intervention that might change the outcome, or at least make those final days more comfortable. So, let's cut straight to the chase. Cheney-Stokes respiration. That's the name of the phenomenon many healthcare providers call a last-stage indicator. It's sometimes referred to informally as a pattern of breathing before death, although it can also appear in conditions like heart failure or stroke at other times. The hallmark is a cycle of breathing that starts shallow, gradually becomes deeper, then drops back down until there's a period where the person actually seems to stop breathing altogether. It can be startling to witness. Often, family members panic because they see their loved one pause for what feels like an eternity. No breath, no movement, and then suddenly they drop or take a heavier breath. This cycle can repeat every 30 seconds to 2 minutes or so. According to studies published in the National Library of Medicine, Cheney-Stokes respiration occurs due to changes in how the brain regulates breathing. It's often related to severe cardiac issues or neurological conditions, and in the very old or terminally ill, it can be a sign that the body's systems are no longer in sync. The regulation of oxygen and carbon dioxide is out of balance, and the result is this irregular breathing pattern. When it appears in a person who's already extremely weak, bedridden, or dealing with multiple organ system declines, many palliative care experts consider it one of the strongest predictors that the end might be near, sometimes within days or even hours. Now, I know this might sound terrifying. You might be thinking, what if I notice this in myself or someone I love? Is it definitely a death sentence? Not necessarily. There are documented cases where Cheney-Stokes respiration occurs and the individual stabilizes for a time, particularly if they receive immediate medical attention and if the underlying cause is somewhat treatable. However, in the majority of cases involving advanced age, multiple comorbidities, or end-stage disease, Cheney-Stokes respiration signals that the body is shutting down and preparing for the final transition. While that might not be pleasant to hear, it can be invaluable information. Let's talk about real experiences, because medical texts can sound so detached and clinical. Families who've sat at the bedside of someone exhibiting Cheney-Stokes often describe the eerie stillness followed by a labored, gasping breath. They sometimes describe it as if their loved one's soul is already halfway out the door and the body is just trying to catch up. Some people say that in that moment, they understood how fragile life really is, and they felt an overwhelming sense of urgency. Perhaps there were final words spoken. Perhaps there were gestures and expressions that lingered in the memory of those who witnessed it. A friend of mine once told me about her grandmother's experience with Cheney-Stokes respiration, which occurred the night before she passed away. Her grandmother would stop breathing for almost a minute, and my friend would think, "This is it." Then there'd be a ragged intake of air, and she'd start breathing again. For my friend, it was the final warning that they were out of time. She called the rest of her family, and everyone gathered around for their last precious goodbyes. The next morning, her grandmother was gone. Multiple institutions that specialize in palliative and hospice care, such as the Hospice Foundation of America, have gathered data indicating that Cheney-Stokes respiration is commonly observed in patients who are within days or hours of death. It's not guaranteed. Medicine is rarely black and white, but it's a recognized sign. In a study published by the American Journal of Hospice and Palliative Medicine, researchers found that this breathing pattern was present in a high percentage of patients entering the final phases of life from various diseases, including end-stage congestive heart failure, advanced kidney disease, and some forms of cancer. One of the most critical pieces of advice from that study is that if you spot Cheney-Stokes respiration in someone who is not yet under hospice or palliative care, consider talking to a healthcare provider about comfort measures immediately. While certain interventions might prolong life slightly, the main goal often shifts to ensuring that the patient isn't experiencing distress or severe discomfort. Opioids or sedatives can sometimes help regulate breathing patterns, or at least mitigate the sensation of breathlessness or panic. Some families opt for a do not resuscitate order at this stage, especially if the patient's quality of life is profoundly compromised. These decisions are deeply personal and can be influenced by the patient's previously stated wishes, religious beliefs, or family consensus. If you or your loved one is exhibiting any kind of abnormal breathing, whether it's Cheney-Stokes or another irregular pattern, please talk to a doctor right away. According to Dr. Timothy Plant, a pulmonologist who has worked extensively with older adults in end-stage conditions, the faster you address potential breathing irregularities, the better your chances of either stabilizing the condition or providing much-needed relief. It's also a good idea to ask about other potential causes of irregular breathing, such as sleep apnea, which is not necessarily a sign of impending death but can be serious on its own. Being proactive in this situation could be a matter of life and death, or at least comfort and peace during one's final days. Now, is Cheney-Stokes respiration the only sign you should worry about? Absolutely not. Other indicators that death could be near for an elderly person might include rapid changes in consciousness, sudden drops in blood pressure, an acute decrease in urine output, and mottling of the skin. When the skin starts to show blotchy, purplish hues, typically around the knees and feet. A severe reduction in appetite, as in the person suddenly stops eating or drinking almost anything, is also common in the final stages. But while many of these signs can appear over days or weeks, Cheney-Stokes respiration stands out because of its alarming and very noticeable nature. It's not subtle, and once you've seen it, you'll never mistake it for something trivial. Let's address something just as important as the physical reality: the emotional impact. If you witness Cheney-Stokes respiration in a loved one, you might feel panic, fear, or an overwhelming sense of helplessness. That's natural. It's also natural to feel guilt if you don't know how to respond. You might wonder, should I call 911? Should I call hospice? Do I need to perform CPR? These are questions that are best answered by having conversations with your healthcare provider ahead of time, especially if you or your loved one is already in declining health. Advance directives, living wills, and open communication about end-of-life wishes can prevent frantic, painful decision-making in those final moments. When you plan ahead, you can face this moment with greater clarity and support. Palliative care specialists often recommend that families create a comfort plan. This might include preferred music, supportive pillows, or controlled lighting. You can speak softly to your loved one, hold their hand, or just be present. Studies show that hearing might be the last sense to go, so even if they seem unresponsive, your words of comfort could still reach them. This emotional and psychological care is sometimes overlooked in the rush of medical interventions, but it's so vital. Studies from places like the National Institute on Aging emphasize the importance of keeping a patient comfortable and addressing symptoms like shortness of breath, pain, and anxiety in those final days. Medications such as morphine are commonly used, not necessarily to hasten death, but to ensure that the patient does not suffer from severe respiratory distress. Something as simple as adjusting their position in bed can make a huge difference. Placing them on their side can help secretions drain more naturally, which might reduce the characteristic rattling sound. However, one must remember that these are not cures. They're supportive measures aimed at easing the transition. Experts also underscore that if you notice Cheney-Stokes respiration in an elderly person who has not previously been diagnosed with a serious illness, get them to a medical professional as soon as possible. Sometimes an acute event, like a stroke or severe infection, can lead to irregular breathing patterns. In such cases, prompt treatment might reverse the underlying cause. But especially if they're over 70, have multiple health issues, or are already in advanced stages of a chronic disease, this breathing pattern often foreshadows an imminent end. There was a 2018 case study from the Journal of Palliative Medicine that discussed a 78-year-old man with late-stage prostate cancer who developed Cheney-Stokes respiration unexpectedly. Until then, his condition had been relatively stable, and his family was hopeful he might have months left. But once the distinctive breathing pattern appeared, hospice nurses explained that he likely had only a short time remaining. His family chose to keep him comfortable at home, surrounded by loved ones, rather than rush him back to the hospital for aggressive interventions. He passed away peacefully within 5 days. This example underscores the significance of recognizing the sign early. It gave his family just enough time to come together, resolve personal matters, and ensure he wasn't alone in a sterile environment. Now you might wonder if this entire discussion is just pure alarmism. Are we trying to scare people into thinking they're doomed the moment they see any kind of abnormal breathing? Let me be clear. The goal is not to terrify, but to inform. The unfortunate truth is that many individuals don't know what Cheney-Stokes respiration is, and they might miss the critical window to arrange for hospice care, say their goodbyes, or provide comfort. We live in a society that tends to avoid discussions about death as if it's taboo, and that avoidance can lead to more suffering. It's worth pointing out that modern medicine has gotten better at prolonging life, but it hasn't necessarily improved the quality of death. Researchers like Dr. Ira Bioch, a palliative care physician, have advocated for a more open conversation about end-of-life processes. Knowledge about Cheney-Stokes respiration is one small part of that. If you know the warning signs, you can make better choices, whether that's seeking immediate medical help or ensuring that your loved one's final days are spent in a place of comfort and dignity. Why listen to this warning? You might still be skeptical. You might be thinking, I've never even heard of Cheney-Stokes respiration, and I'm not sure it's that big of a deal. The reality is, there are countless testimonies from hospice nurses, geriatricians, and families who have seen this pattern time and time again in those final days. If you've never encountered it, consider yourself fortunate. But if the day comes when you do see it, perhaps in your own body or in someone you deeply love, you'll be better prepared. You won't be completely caught off guard, and you'll have an understanding of why it's happening and what steps to take. Maybe those steps involve calling a doctor, or maybe it's simply gathering the family together for last rites, prayers, or quiet reflection. This kind of preparedness is not morbid. It's actually a form of compassion, both for the person nearing the end of life and for the people who love them. Researchers at the University of Washington have found that families who have open discussions about end-of-life care often cope better with grief and have fewer regrets later on. Being blindsided by a loved one's sudden decline can leave you feeling helpless, questioning whether you did enough. Knowing about Cheney-Stokes respiration and other final stage indicators won't remove the sadness or the pain, but it can help you feel more in control of a situation that is, by its nature, so uncontrollable. I want to hammer home one more point. Seeing the sign doesn't automatically mean it's all over, but it often means that you have very little time left, a matter of days, possibly hours. That window, however narrow, is precious. It's a chance to hold someone's hand, to look them in the eye and to say, I love you. Thank you for everything. It's a chance to ask for forgiveness, to share a cherished memory, or even to contact a distant relative who might want the opportunity to say goodbye. In some cases, healthcare providers might initiate medications that ease the sensation of smothering or breathlessness, which can at least allow for a more peaceful passing. It's important to remember that we're not just our bodies. We have emotional, spiritual, and relational needs that become even more pronounced at the end of life. Knowing the sign and heeding it means you can foster an environment where those needs are met. Maybe that means playing a favorite piece of music softly in the room. Maybe it means reading a beloved passage from scripture or a favorite book. Maybe it's simply holding someone's hand. All of that matters deeply in the final moments. In fact, hospice workers and chaplains often recount stories of patients relaxing or even smiling when they sense that their loved ones are near, providing comfort and reassurance. Why do I emphasize "do not ignore" in the title and throughout this video? Because ignorance can rob you and your family of that final connection, that last bit of closure. It can also lead to a chaotic rush to the emergency room, where the person might pass away in a flurry of medical interventions that do little more than prolong suffering. Yes, there are cases where immediate hospitalization can extend life meaningfully, but more often than not, when Cheney-Stokes respiration sets in for someone with chronic advanced illness, the medical consensus is that they are on a very short path toward the end. So if you're over that, or even if you're younger but caring for someone who is, make a mental note of Cheney-Stokes respiration. Understand it, recognize it, and be prepared. It's not about living in constant fear. It's about being informed enough to make compassionate, clear-headed decisions when the time comes. If it doesn't come for you or your loved ones, that's wonderful. But if it does, you'll be thankful to have some idea of what's going on rather than standing there, terrified and uninformed. Death is a topic most of us don't like to discuss. It's uncomfortable, it's sad, and it reminds us of our mortality. But as we get older, the reality is that these conversations become more and more critical. Knowing that Cheney-Stokes respiration could mean you have only a few days left gives you that small but significant window to put your affairs in order, to say your farewells, to focus on comfort and peace rather than frantic, last-minute decisions. This knowledge can be an unexpected gift, granting you or your loved one the final dignity of a death that is, at the very least, not marked by confusion and panic. So please, if you notice this sign, this eerie cycle of breaths that fades away into silence and then resumes with a gasp, do not ignore it. Contact healthcare professionals, talk to family members, and make sure everyone understands what this could mean. Whether you decide to seek hospital care or remain at home, let it be a choice made with open eyes and an informed mind. No one wants to think about death, but it's a natural part of life, and being informed is one of the most powerful ways to face it. It might be frightening, but it can also be a moment of profound connection and love. So watch for this sign. Remember what you've learned here. And when the day comes, face it with courage. Acknowledge and compassion. Because if you're over 70, or you have someone you love who is, these final days or hours can be some of the most important ones you'll ever experience. Don't let them slip away unrecognized. Don't let them be overshadowed by panic or uncertainty. This is your wake-up call. If you see this sign, death might be just days away. Do not ignore it. Take action and make every remaining moment matter.